B, statin drugs deplete coenzyme Q10, and coenzyme Q10 is desperately important for the maintenance of brain function and health. So, am I saying to anybody here, go home and throw out your statin drugs? Well, I'd like to, but no, you don't. But if you're taking a statin drug or any of the other drugs that are listed in your handout, make sure that you're taking adequate amounts of coenzyme Q10. The severe myopathy or muscle pain that people have developed, which can be permanent from statin drugs, is now unequivocally shown to be directly related to the effects of statin drugs on the CoQ10 levels in muscle cells. We learned this morning that we can have a dramatic effect on lowering cholesterol without taking statin drugs by using some things like red yeast rice and polycosanols, raising HDL with niacin, or I prefer using niacinamide, and also exercise. Exercise being possibly the most important, but you can't put it in a pill. That was a short answer.
Thank you.
Yes, ma'am. Are you guys like the designated question askers? Okay, good. No problem.
Two-pointed question. What is the difference between dementia and Alzheimer's, and what do you think of ginkgo biloba?
Well, I think it's really not that important that we differentiate between Alzheimer's and dementia per se. You can have dementia induced by various things. For example, severe vitamin deficiency, alcohol abuse, trauma, etc. And you can become demented, which simply means that your brain isn't functioning well. But by and large, many times I've had patients come in, they say, bringing my dad, he doesn't have Alzheimer's, but he does certainly have some dementia. He has minimal cognitive impairment, MCI. He will have Alzheimer's disease. So by and large, when a person is demented, that is, early on is going to be Alzheimer's or already is Alzheimer's disease, except for those small group of individuals who have cognitive impairment or brain function impairment for one of the other reasons I just mentioned. Second question, ginkgo biloba. I'm very fond of ginkgo biloba. And starting off by the fact that it was used in Chinese medicine for people who had dementia, 3,000 years ago. Now, where did they come up with this? A plant, coming from the bark of a tree, that now when we take it apart scientifically and try to find out why it works, we learn that it has a profound effect as a brain antioxidant. But more importantly, not to be technical, but limits the influx of calcium into neurons, which is a damaging event. But how does that knowledge arise in the Chinese medical text from thousands of years ago? So the answer is yes. The original work done by Dr. Labarre, published in the Journal of the American Medical Association, I think, has held water and is very supportive of ginkgo, and we definitely use it.
Can taking DHA help children and teenagers who already have ADD, ADHD, and who have previously been on medications for these?
Absolutely. Had I had time, I have a nice presentation with a couple of cases of kids. One 4-year-old kid saw his pediatrician, and he was having issues in school with hyperactivity. The pediatrician put this 4-year-old kid on Ritalin. Well, gave the mother the prescription. They never took it. The pediatrician who takes Ritalin himself. And so he's actually his case is actually presented in our new book, Raise a Smart Child by Kindergarten, as is another child who was on medication. So it's very frequent that we're able to get kids rapidly off of their medications for ADHD and ADD, not only by paying attention to high dosage DHA, but also by identifying specific food sensitivities, by and large being gluten sensitivity, which is a simple test, one of the 4 fundamental tests we do in children, and also adding appropriate vitamins and reducing things like television exposure. We are able to get probably 90% of the kids we see off of their Ritalin drug, a drug that works by stimulating the cocaine receptors in the brain, a drug that has never been proven effective more than 2 years, but yet kids are taking it 10, 15 years. So I think it's a very important issue to do everything you can to get kids off of those drugs. I think that what's going on in our country is something to be ashamed of. If I'm invited back next year, we'll talk about children. Last question.
What is the best lab for checking all our levels of vitamins?
Actually, there are various laboratories out there, and it might be that you asked the other panelists this afternoon the same questions. I use a test called SpectraCell. There's a lab called Genova Diagnostics, which used to be called Great Smokies Diagnostic Laboratory. There's really, I have found not one lab that does everything that I want, because I like to look at fatty acids, I like to look at nutrients, I like to look at antioxidant function, and those specific labs, for example, don't assess heavy metals, so that's another laboratory study as well. I want to close by the slides that I ended on, and that is the importance of starting early and the importance of children's brain health. And as I said, given the chance, I would come back next year and lecture on that, because I think it's something that's close to all of our hearts. And again, I appreciate your time. Thank you.